8 early warning signs of ovarian cancer that women often neglect. This is a scientific video which is based on research findings published in famous peer-reviewed journals and government reports. Please see the reference section available at the end of the video for source papers. Ovarian cancer is often described as a silent killer because its early symptoms can be vague and easily attributed to benign conditions, example, menstrual changes, indigestion, aging. However, a large body of research shows that most women with ovarian cancer experience symptoms well before diagnosis. The challenge is recognizing which symptoms are persistent, new, and unusual for the individual. Below I summarize 8 early warning signs that are commonly missed or minimized, explain why they matter, and give practical guidance for when to seek medical attention. 1. Persistent abdominal distension or daily bloating. Many women call it bloating, but persistent abdominal distension, a sustained increase in abdominal size or daily bloating that does not come and go with the period or food, is an important red flag. Studies showed that sustained distension, not transient bloating, is associated with ovarian malignancy and should prompt evaluation. Track whether the feeling is new and happens most days for weeks. 2. Pelvic or lower abdominal pain. Ongoing pelvic or lower abdominal pain, especially if it is new and persistent rather than cyclical, is one of the most common presenting symptoms even in early-stage disease. Women sometimes dismiss this as period pain or backache. Persistent or progressive pain merits a clinical review. 3. Early satiety loss of appetite. Feeling full after eating only a small amount, early satiety, or an unexplained, consistent loss of appetite can reflect a pelvic mass or ascites pressing on the stomach. This symptom has been shown to discriminate women later found to have ovarian cancer from those with benign conditions. 4. Urinary urgency or frequency, new and persistent. Needing to pass urine more often or urgently, without a urinary infection, is an overlooked symptom. Because pelvic masses can press on the bladder, persistent urinary changes, occurring most days, should prompt evaluation rather than repeated attribution to urinary tract infections or aging. 5. Persistent fatigue and reduced energy. Chronic, unusual tiredness that is new for you and does not improve with rest is common but easily dismissed. While fatigue is non-specific, when it occurs alongside other warning signs, bloating, pelvic pain, appetite change, it strengthens the case for medical assessment. 6. Changes in bowel habits, constipation or diarrhea. New, persistent constipation or changes in bowel pattern that do not fit an established diagnosis, example IBS, can reflect pelvic abdominal pathology. Women often attribute such changes to diet or stress. If persistent and unexplained, investigate further. 7. Unexplained weight change and increasing abdominal girth. Some women notice unexplained weight loss, but in ovarian cancer a subtle increase in abdominal girth, not just bloating, or a gradual, unexplained change in body shape may occur. Because weight change is often normalized, it can be missed. Document and report steady changes to your clinician. 8. Abnormal vaginal bleeding or postmenopausal bleeding. Although postmenopausal bleeding is classically linked to endometrial pathology, abnormal bleeding, especially after menopause, or bleeding between cycles should never be ignored. It can be associated with ovarian or other gynecologic cancers and needs prompt assessment. When to see a doctor, practical rule of thumb. If you notice any of the symptoms above that are new for you, persist most days, and last for more than 2 to 3 weeks, make an appointment with your primary care clinician and describe the frequency and duration. Clinicians will usually take a focused history and may order examination, pelvic ultrasound, and serum markers, example CA125, as part of the workup. However, no single test is perfect, and persistent symptoms often drive further evaluation. Why symptom awareness matters? Because population screening for ovarian cancer has not proven sufficiently sensitive and specific, increasing symptom awareness remains one of the most pragmatic strategies for earlier diagnosis. Studies show that a high proportion of women report symptoms prior to diagnosis. The problem is that symptoms are non-specific and commonly attributed to benign causes, which delays referral and diagnosis. Goff et al., 2004, Bast et al., 2020. Educating women and primary care teams to recognize patterns, new, persistent, frequent, improves the chance of earlier detection and better outcomes. Bottom line: don't wait it out for symptoms that are new, unusual for you, persistent, and happening on most days. Keep a short symptom diary: what you feel, how often, and since when, and share it with your clinician. Small, consistent changes sometimes signal something important. Thank you for watching this video. Please subscribe to our channel BP International to watch more videos in the fields of science, technology and medicine.